Hi everyone, how are you today? Heart Health Month, so what can we talk about today for heart health? Well, let's talk about testosterone. Now, testosterone's not just particular to men only. Women need and have testosterone, we just have much less. So guys, let's just talk about you, because we've always known that men are at high risk for heart disease, and we've ignored over the years the fact that women are rising in their risk factors and they're rising in the incidence, and it's becoming a real threat and significant health epidemic for women. So back to men. What happens as you drop your testosterone levels? You get a little bit more tired, maybe a bit irritable. Your workouts at the gym aren't as effective. You have to work out harder for longer and still not get the same result. What else? Your belly starts to grow, right? So your belt size increases. You start to get that beer belly look. Your muscles aren't as firm. Let's talk about sex drive. Your erections aren't as firm. They're not as frequent. Your morning erections go down in frequency. Your sexual performance declines. And men notice this. They also notice endurance and stamina reducing. They notice the focus and sharpness mentally is reducing. And so, often I tease that your performance in and out of the boardroom are affected by testosterone, and so you could say in and out of the bedroom as well. Now, why is testosterone relevant to heart disease? Well, a couple things. A study in Europe many years ago looked at giving men testosterone while they were having an angina attack. Now, angina is where your blood vessels constrict in the heart, you reduce the blood flow, and you get that chest pain, but it goes away with rest, or it doesn't last, right? So either it's exercise-induced or activity-induced, or it can happen at rest, and then we call it unstable. But either way, angina comes and goes. It's not the heart attack. It's the warning that you're able to get a heart attack and that you've got blood vessel spasm, blood vessel constriction, and something wrong with the blood flow to your heart. And what they did was they looked at men having an angina episode and they gave them testosterone. And what do you know? Testosterone solved the angina. They didn't need to do the under-the-tongue spray to solve angina. So that's a really curious thing. And then, over 10 years ago, they started to notice, and the studies showed, that testosterone affects blood sugar levels and the control of diabetes in men. So what we have here is that when men drop their levels of testosterone, which they do as they get older, their ability to control their blood sugar gets worse and their diabetes gets worse. And by restoring and optimizing testosterone levels, the diabetes control improves. Now, what's that all about? Diabetes ages you much faster on the inside, and so you have to think that you're 10 to 15 years older when you're a diabetic, cardiovascularly and inside your blood vessels, right? So testosterone brings back your youth, right? And what we know is that managing testosterone levels improves overall health outcome for men. Now, if you're aging faster than you should because you have low testosterone levels, should you not replenish them? Well, I wish it were that easy. And with androgel and all of this other marketing out there, yes, it's pretty easy to, go out and get a prescription for testosterone, and well, great, right? However, I've been saying this all along, how your liver functions, how congested your liver is, how are your liver enzyme pathways, how is your digestion, how is your microbiome, how are we eliminating estrogen metabolites, all affect safe testosterone balance. And what we know is that your risk for prostate cancer is not elevated by taking testosterone, because if testosterone were all there was to raise your risk for prostate cancer, that's a myth, that testosterone raises your risk for prostate cancer. Testosterone is highest in men in their teens and 20s. So why aren't 30-year-olds having the most prostate cancer, right? We get prostate cancer in your 60s, 70s, and 80s. Well, what does that correlate to? That correlates to the decline of testosterone levels in men. So it's very old school, bad science, bad press, and it's stuck with everyone that testosterone causes prostate cancer. It does not. But what does is not monitoring the safe balance of testosterone and what happens inside your body when you take testosterone. And how does your body handle the testosterone supplementation? So that's critical, and that's what we do at Better. When we prescribe for you, we're looking at every system in your body that affects its metabolism, and then we look at how to keep you safe through it, because we know that you're healthier overall, not just your heart, not just your penis, but all of you is healthier overall when we give you testosterone back to youthful levels. Now, one other really critical thing I want to talk about when it comes to testosterone and men. Why is it that younger and younger men are having low testosterone levels and all the symptoms associated with low testosterone? Well, all of these environmental toxins and chemicals that I've been telling you about over the last many weeks, right? All of these things, the herbicides, the pesticides, the xenoestrogens, triclosan in hand sanitizer and all of your antibacterial dish detergent, hand washing soap, wherever you find antibacterial things, triclosan has been shown to block testosterone production. So if, it's something as simple as what you're putting on your skin and using every day that can be lowering it. Then we also know that cortisol and stress affect testosterone production. Your nutrition and your amount of building blocks affect your testosterone levels. The list is endless. It's lifestyle, it's diet, it's nutrient depletions, it's how your liver can work, how your body can work. And we're all getting sicker faster these days. So for anyone out there thinking about testosterone replacement, yes, you should have it. But no, don't do it unsupervised. That's when you start running into trouble. I've seen many young men come to me on underground testosterone and everything from man boobs to back knee is what they're talking about. And these are the side effects of unsupervised testosterone replacement therapy. You might feel good on it, you might get great results on it, but if you don't know how your body is metabolizing it, and much of it is affected by your genetics. So that's one other area we look at. And we don't necessarily do genetic testing, but we look at how the genes affect certain metabolic pathways. We check those pathways and we say, you're probably safe to take testosterone, and we'll check you every so often. Or you know what, you need your checkups much more often because it looks like your genes aren't doing the right thing with certain molecules in your body. So I love testosterone replacement therapy. I've seen it transform the lives of many, many male patients of mine. They go from being tired and irritable and grumpy old men to feeling amazing and awesome. It's more than just about the sex drive. It is all about function, performance, how you feel mentally and physically, and that's what healthy hormone balance is about. That being said, people not looking at total hormone balance are the ones that are going to run into trouble, because what we know is that there's hormones that control how you live and how you feel, and then there's ones that keep you alive. And it's all about the balance between your life-sustaining hormones and your non-life-sustaining feel-good hormones, right? And testosterone really is a feel-good hormone. It is produced by the man's testicles. It is made at the highest amounts in youth and young the 20-year-olds, and then from age 30 it starts to decline. Men who are active, men who are fit, men who have high muscle mass manage their testosterone levels much, much better. But the younger people are not following that rule. I have many, many 28 to 35-year-old men in my practice with low testosterone levels, low for their age and low for how they're functioning. And I don't run out and give them testosterone on the first visit. I make sure to screen all of their body systems. I make sure to look at how their body's working and what else can we do to improve overall function, right? And so from there, we'll move into maybe adding some hormones to bring it back up to optimal levels. Well, You want to look at your diet, you want to look at your lifestyle, you want to look at all of the toxins, and then you want to look at stress and these overarching metabolic triad hormones called cortisol, insulin, and thyroid. When these are out of balance, you can really chase testosterone replacement and not get great results. So what I'm seeing is guys getting testosterone from someone from the gym, and they're so happy because they feel better and they're building muscle and they're whatever, and then I look at them and they have high estrogen. I have a 26-year-old with estrogen higher than any woman in my practice right now, and what's happening is he's injecting with testosterone and it's all downstreaming along a metabolic pathway straight into estrogen. So yes, he's growing man boobs, he's got breast tissue, he's going to need surgery to get rid of that. But look at his overall risks, and the higher the estrogen goes, the less effective the testosterone feels inside the body. So if we're not looking at stress and cortisol and thyroid and insulin and all of these life-sustaining hormones, you will have to overdose on your testosterone in order to feel like you have enough. And that's not what I do at Better. At Better, we're wanting you to be safe and as natural as possible. We want you to be optimized in the healthiest way, and we want you to live a long and productive life. So follow me at www.newrulesforbetterliving.com. That's where you sign up for my newsletters, and that's where you'll stay updated with the health information I send you. And then tomorrow I'm going to be talking about dairy and how that affects your health, your heart health, and why I have no cow milk products in my home, and my children have always been dairy free, and they're healthy, and so am I. So that's what I'm going to be talking about next. But today I hope you've got a really good understanding of why you need testosterone balance as a man for your risk for heart disease, to improve your blood sugar control, to improve your weight management, but also to know that testosterone's not the be-all and end-all. And I do 2-hour teachings at the clinic. You're welcome to join me anytime to learn more about how to balance your hormones. I'm Dr. Natasha Iyer.